When a child is diagnosed with a chronic illness, condition, or disability, it can be a devastating experience for a family, emotionally and financially. Many parents become overwhelmed by the endless paperwork, relentless medical bills, and unexpected expenses that accompany a serious illness. Suddenly, even the most responsible and stable families can find themselves on the brink of financial ruin. It seems unfair that parents should have to consider money issues during such a difficult time. But you can maintain control over your finances by learning how to seek and obtain help, making simple lifestyle changes, and empowering yourself with the knowledge you need to advocate for your child.
We could afford anything we wanted. Our children had anything they needed. Our bills were never a problem. We lived to the highest of life. You minus half of that and learn to live on half of that, and things go upside down. So, of course, it hit me immediately. Oh, my God, I am not going to be able to make the rent payment. I'm not going to be able to make the car payments. I'm not going to make the credit card payments. Life changed dramatically in all aspects. Financially, emotions, you name it. It just all changed.
Oftentimes, families don't think about the financial implications of their child's illness until they're hit with the first bill or they're hit with their explanation of benefits and they don't understand it. And it's really difficult sometimes for you to say, and often families could get offended by saying early on that you need to think about the financial implications of your child's illness.
Dylan was born with spina bifida, which is the #1 birth defect in the country. When you're faced with a child with as many medical complications as Dylan had, we were just worried about having him breathe every day, and the last thing we thought about were the bills.
First and foremost in my mind were all of the things that I had to learn and know about the difficulty of caring for if this child lived through everything and what it was going to encompass taking care of her. Financially, it was a disaster coming. It puts a strain on your pocketbook that you would not believe. Her first hospital bill, not including surgery and not including anesthesia, was $308,000.
The costs of long-term health care can be staggering, but there are ways to handle these costs effectively. Negotiating the healthcare system is an art you can learn to master. The first step is to know and understand your health plan.
Most families don't understand their health plan. We learn that early on when they come to the hospital. Many families don't even understand what hospitals or physicians are in their network. They don't understand what benefits are covered under their health plan. And many families don't even understand the plan design. There are also a lot of terms that relate to insurance that may be very confusing to families, like deductible, copay, out-of-pocket amount. And those can be explained in several ways. They can either access their benefits manager at their employer, who could explain that to them, or they can call the number on the back of their insurance card. And all insurance companies either have subscriber services or member services that are available to them to explain the plan design and any out-of-pocket amount that the family may incur.
Understanding your plan's design and its policies regarding referrals, authorizations, and out-of-pocket costs can ultimately save you thousands of dollars.
I had to educate myself completely. I had to call my insurance company and ask specifically, is this covered? What is covered? What is not covered? Am I in my network? I had to make sure I covered all of my bases. Otherwise, I would have been left with total chaos with the bills.
I strongly suggest to every family that I see in clinic that they get a copy of their policy from the insurer. The insurer will oftentimes tell them, well, your human resource department has that book that we send out. No, that's just an enrollment informational book. You guys at the insurance companies have the actual policy, and I would like to see my actual policy.
Parents can easily become confused when trying to make sense of the steady stream of medical bills, reimbursements, and benefit statements. Bills seem to come from every direction: the hospital, the doctors, the laboratory, and more. But there are simple steps parents can take to avoid chaos. Locate the resources available within the hospital that can answer questions about your child's medical expenses. The hospital business office can usually explain charges on bills, provide justifications to your insurance company, and even estimate how much a service will cost before it's performed. Ask to have a case manager assigned to your child.
Often hospitals have a case management department, which is made up of nurses who talk on the phone every day with the insurance company about their hospitalization, and those case managers can be accessed and will understand or have a good understanding of their health plan for their hospitalization.
If your hospital does not have case managers on staff, ask your insurance company to assign one to you. Make your child's health care providers aware of your plan's benefits and limitations. Encourage them to coordinate your child's care with your health plan as much as possible. Negotiate fees with physicians, clinics, and hospitals. Set up realistic payment plans with them if necessary. Remember that your child's physician and the hospital or clinic each bill separately. Keep a diary and organized files so that you have detailed information about your child's health care readily available.
I've told many families that in order for them to sort of keep it straight, particularly in a time of crisis, just bringing a notebook with them to every visit and jotting down, a certain test that was had, what physicians came in, will help them sort of piece together these things when their bills come in and when their explanation of benefits come into their home.
Brianna's expenses were astronomical. They were $2.2 million. We were responsible for 10%, so roughly $220,000. The best advice I can give, your home, have a folder for that budgeting. Your medical bills, have a folder for that budgeting. And your out-of-pocket limited expenses, make sure you keep every receipt possible. You can claim it all on your taxes.
Know your rights as a health consumer. If your insurance company denies coverage for certain expenses, you can appeal the decision.
People don't know that they have those rights to appeal decisions, and oftentimes if they do it together with their physician, they're able to overturn a decision that may impact their child's care.
Most people who actually send in an appeal for something that's been denied get it approved. People sometimes don't take that extra step that's needed to get these things approved.
If you encounter problems with your child's health coverage, contact your state's Department of Insurance. Unfortunately, even with a good health plan, parents should be aware of the costly related expenses involved with caring for a child with a chronic illness. Transportation, parking, and lodging during hospitalization or medical visits. Meals away from home. Childcare costs for siblings. Tutoring for a hospitalized child who is unable to attend school. Special diets, clothing, and medical equipment. Respite or special home care for the child. Increased utility costs for children requiring medical equipment at home. Home renovations for handicap accessibility. And of course, gifts for the sick child, as well as for siblings in need of attention. Families are soon struggling to meet these new expenses, usually with the loss of one spouse's income. Regular monthly bills are often put aside or ignored. Debt starts to grow, and bill collectors begin to call.
When we realized that Candace was going to need a lot of rehabilitation, all we were concerned with was just getting what she needed, and kind of like just forgetting about everything else. Because that's all that was important to us at that point. Since I was at the hospital with Candace, I wasn't really aware of what our financial situation was really like at home. All that I knew was that I needed money every day to get food. I had to buy food from the cafeteria. I had to buy other personal items from the hospital gift shop. By the time Candace was discharged and we got home, there was like the biggest stack of bills sitting on the mantle. That's when reality hit me.
They need to start watching the bills that come in as soon as they come in and ask questions right away, not let them pile up. Very often families wait until they have boxes and boxes of bills and explanation of benefits before they react.
The first time that we started feeling some of the financial crunches is when Dylan experienced a long-term hospitalization. It started the December before he turned 2. He was in and out of the hospital over a 6-month period. He was there most of that 6-month period. So you might let one bill slide 1 month and try to catch up with it the next month, and let another bill slide that month. And you can do that for a little while, but then it starts to snowball. And after you have a kid in the hospital for 6 months, you can imagine the snowball effect is pretty severe.
Warning signs of financial crisis include spending more than you earn, making everyday purchases using credit, making only minimum payments on bills or skipping payments entirely. Saving is inadequate or non-existent. Using cash advances on credit cards to pay other expenses. Getting calls from collectors about overdue payments. And receiving notices about utility disconnection.